Hello and welcome to a candid conversation on bodily autonomy. We are broadcasting from the Women Deliver 2019 conference, and I'm here with Lucy Stackpool-Moore of the International AIDS Society in Geneva and Nelly Munyasia of the Reproductive Health Network in Kenya. Welcome to the show.
Thank
Thank
you
you.
so
Lucy,
much.
how does the advancement of gender equality relate to the fight, the current fight that we're having on the continent around HIV and AIDS?
That's a great question. I mean, it's absolutely everywhere. Addressing gender inequality is essential for every possible aspect of the response in terms of access to services, both for women but also for men. I think women need to be empowered and men need to be empowered to create space for women to have the choices and the rights that they deserve. And I think we really need to recognise the diversity across genders. So it's not only male, female, but also recognising the diverse needs of transgender people, also young people exploring their sexuality and coming to terms, even discovering what it means to them to be a young man or a young woman or a young trans person. And I think really recognising gender and engaging with its complexity is an important way to then provide the best quality and nuanced health services that everybody needs, actually, in terms of HIV, but also in terms of being a person and performing our gender and being comfortable in our own skin.
Right. And Nelly, you're a midwife. So, how do you get drawn into the conversation about advocacy?
Thank you so much. We all know that advocacy and service delivery cannot work in isolation. And if we are advocating for the rights of the girls and women, this translates into access to quality, comprehensive sexual and reproductive health services. So for us, how we get tied is because while we advocate, we need to see the end results. And the end results mostly are found at the service delivery point. Access, in terms of data, access in terms of reduction in the maternal and mortality, So there's no way we can separate advocacy and service delivery. Advocacy leads to, creating policies that speak to services, creating an enabling environment through policies, through advocacy and all that. So yes, that's how we find ourselves advocating for, at the end of the day, quality, comprehensive services.
And I suppose this question is for both or either of you as to let's take the situation in Kenya, for example. Is it possible for a woman to be able to get multiple services under one roof? Because part of the challenge is having to go to different locations to get different services. So, are we at a point in Kenya where women can be able to get all these services under one roof?
Yes. I will talk about the network that I work for, which is a network of trained healthcare providers. And most of our providers are mid level providers. And what we've done when we talk about sexual and reproductive health, we are talking about gender-based violence, we are talking about HIV, we are talking about access to safe and legal abortion services, we are talking about cancer screening. So immediately you start separating these services, you're going to miss out. Because if we are targeting, for example, the young people, the girls and women, they'll come to you for different reasons. Some of them will come to you for access to safe abortion services because of probably rape. And immediately you're going to refer them to client B. I mean, to provider B to, for example, do a HIV test. You're already exposing them. They've trusted you with the information that they do not want to again go and repeat the story. You can imagine how painful it is for me to come and share with you what I've gone through to get an unwanted pregnancy. And you refer me to a provider XYZ to go and repeat the story. So yes, in Kenya currently, we are encouraging our network providers to integrate, have a one-stop shop where a woman walks into a facility and they're able to access all the sexual and reproductive health services and information that they need.
I think
Yeah.
you're absolutely right.
Yeah.
Integration, the integration of
Yeah.
services really makes good people sense. It's about responding to that individual person's need. In
Exactly.
your example, a young woman living with
Yeah.
HIV, it's about her making that journey to go and access a service, but actually during that time she's there to receive everything she needs. If it's
Exactly.
access to contraception, if it's psychosocial support, if
Mhm.
it's care for gender-based violence, if it's referral for maybe it's to a dentist, but it's actually for her, saving her time, maybe some money in terms of transport, and making sure that her health needs are met during that one visit.
And actually also for continuity of care, because they gain the confidence and they assure that their whatever information they've shared with you is in confidence and they're able to keep on coming back for review, continuity. You'll make sure that if it's a HIV positive client, they're able to pick up with the medication, even come back with their partners for HIV testing, for care and all that, even STI treatment.
Right.
So integration of services, I think, is the way to go for us to improve on the quality of care.
So, what would you suggest are the areas where there is room for improvement? It sounds like you're sure there are services that already exist, but there's always room for improvement. Where is it that we can do better?
I think for Kenya, currently our main challenge is funding, because you realize that different donors have different needs. I come and one donor focuses mainly on HIV and AIDS, and they will not want to support, for example, access to safe and legal abortion services. So for me, I feel like donors need to be open-minded and appreciate that sexual and reproductive health services cannot work in isolation. It needs to be integrated for us to have, at the end of the day, to have quality care given to girls and women. So one, donors need to be open-minded, and they need to appreciate that if services are offered under one roof, then the outcome is much more better than funding separately, funding one organization for HIV, an organization for safe abortion services, another organization for cancer and all that. So they also need to appreciate the integration model.
I think to that, I would say the biggest challenge, but also the thing we really, really need to solve, is to remove stigma. And stigma,
Exactly.
whether it's relating to sex before marriage or going for an HIV test, I think it's stigma that is really the biggest barrier for someone accessing the services they need, and equally for providers to do more to provide services that are free from stigma, that are welcoming, that are making somebody want to come to access the services they need. And I think for the IAS, we have various activities where we really try and recognise healthcare workers like yourself who are doing amazing work and are, despite the odds of discriminating laws and policies or other things that might create barriers and might reinforce stigma, but healthcare workers really doing the right thing and making it easier for someone to get the quality services they need for HIV and also other sexual and reproductive
Now,
health.
here's a big question.
Yeah.
What has been the impact, rather, of the global gag rule? I know in South Africa we're suffering from ridiculous consequences, and it's really become a barrier and has taken us back historically to some really, really big grounds that we had covered. So how, for both of you, have you seen the impact of the gag rule in our industry?
I think, let me start quickly and then you can pick it up. But I
Yeah.
think one of the really maybe unanticipated consequences has been the additional impact it has had on actually things that weren't supposed to be the focus of the gag rule, which is obviously linked to abortion. There's lots of issues there in terms of women's right to choose and access to quality services there. But the knock-on effects in terms of people actually no longer able to access their ARVs, life-saving medication, because that clinic has now been closed because the funding for that has been affected by the extension of the global gag rule under the current administration. And you see people who were I guess it's the unintended but really significant life-changing consequences of this policy, in addition to those that it was explicitly setting out to achieve. It's an abuse of human rights.
So it's a life and death situation.
It really
Yes,
is.
yes.
Yeah.
And
Yeah.
I think she's just put it the way it is. As an organization that was affected 100% by the global gag rule, we lost all our funding to global gag rule. Yes.
All of it?
All of it, 100%. And what this means is because they did not want to hear anything to do with safe abortion services. And there's no way we were going to stop offering services, because this means that we were going to let the girls die due to unsafe abortion. And we are talking in Kenya, 7 women are dying daily due to unsafe abortion. So you can imagine immediately you say that, yes, we're going to take funding for HIV and leave safe abortion services. Who is going to take care of the 7 that are dying every day? And this speaks to stigma, as she said, because as an organization, we are saying that we are happy to integrate services. We are ready to take our providers through the training, capacity building, just for them to be able to offer all the needed sexual and reproductive health services. So what the global gag rule did is we were not able to go to the communities and offer the outreaches for contraception uptake. We are not able to continue offering safe abortion services because they say they are not going to fund any organization that has anything to do with abortion. So for us, this meant that the number of girls that we were able to offer contraception in the communities, there was nothing that we were going to do. They were not going to continue getting the commodities, for example, the family planning from our providers. We were not going to continue training providers, for example. And most of our providers are found in the hard-to-reach areas, in the slums. And we understand what kind of population these are. So what the Global Gag Rule meant for us as an organization is having girls not making a choice, leaving girls with no choice to make, leaving girls and women with no access to services. So this means that we are forcing girls, for example, to carry pregnancies that they were not willing to. And for those of us that were to make a choice to access contraception, the contraception is no longer there. So what does this mean? Closing down facilities. Our providers not being able to offer the services that they could offer previously with the support from the support we got from the Planned Parenthood Global. Yes. So
You
it
had
was
talked,
that
Lucy,
bad.
a little bit earlier about unintended consequences, but sometimes I really wonder because clearly either
Yeah.
people had to close shop
Yeah.
or change direction,
Yeah.
and the direction gives women much less access.
Exactly.
So let's just, in closing, let me ask you this question. How do we use the power that we have? I can use the radio and television in order to get messages across and to keep have the conversation alive. What is it for each of you that you think you can do to use your power?
I'm going to answer in two ways. The first one is on behalf of the IAS. We have this great convening power of our annual annual conferences, and the next big one is in San Francisco and Oakland next year, 2020. I'd encourage everybody to come. The theme is resilience, and I think if we've learned anything from the response to HIV, it's all about the power of communities to be resilient, to stand up for rights, and how we can amplify that and continue to do that because the fight is not yet won.
No.
And for me personally, I think my own power as someone in a position that I hold, I have to hold myself accountable and really do what I can to leverage my own integrity, for want of a better word. And for me personally, as you know, my passion is really to confront and address stigma, to start those difficult conversations and to work with the 12,000 plus members of the IS to really spotlight attention and really get to the heart of stigma.
Oh, wow.
Yours is going to be
Power. No, and I love the power. No,
Yeah.
like, yes. Oh, so for me, as a provider, and coming from a country with restrictive laws, I will continue using my power to advocate for policies to make sure that our providers create an enabling environment, basically, for our providers to continue offering services regardless of the situation. Secondly, I want to use my power to hold my government accountable, because at the end of the day, these statistics translates to votes. These statistics translates to brothers and sisters, to sisters and daughters in the country. So I want to be a voice that is able to speak against all odds and make change in my country.
Yeah.
It's been
Amazing.
wonderful having a conversation with you. Keep up the fight.
How will you
Thank
use
you.
your power?
Yeah.
For me, it's about making this conversation accessible all the time. You talked about stigma, Lucy. It's something that in South Africa we also have seen a huge a problem with. With South Africa, we do have termination of pregnancy as something that is constitutionally enshrined, and yet over 50% of all abortions in South Africa are are illegal. So
Exactly.
clearly, there's other issues at play besides just the law. I mean, it's great that we do have the law, but when the law either cannot be enforced,
Exactly.
or when
It's
you
just
have a
on paper.
medical worker, you're a midwife. If a medical worker looks at you and refuses to give you this option of health, the chance of you going to a second person who
quack.
is also a medical worker who knows what to do are much less than going to a taxi rank.
Exactly.
Where there's a sign, a very dodgy sign, you have no idea what is going on, but nobody's going to ask you your name.
Exactly.
And they're not going to ask you too many questions.
Exactly.
And deliver very bad services. And then
that could lead
who
to death.
suffers in the end? You know, for me, I always say there's two options in the world. You know, women will always have abortions. The
Exactly.
choice that we make is whether
Exactly.
those abortions
are
are
safe
going
or
to
otherwise.
be safe
Yeah, yeah.
or
Or
unsafe.
Absolutely
That's
right.
Yeah.
the only choice that we have. So
Yeah.
True.
I'm hoping that in my work with broadcasting in television and in radio to keep that conversation alive,
conversations, yes.
so that it's not something that is hidden, and to remove the stigma and hopefully influence also other things that my government can do.
Yeah.
For example, putting more pressure on workers, on health workers, to be like, well, either, you know, if you're not going
it.
to perform this, then you cannot be
Exactly.
a midwife, then you cannot
Exactly.
be a doctor.
Exactly.
That's what I'm hoping to do with
Okay.
But you
my
know, again,
power.
the midwives somehow, the healthcare providers somehow their hands are tied, because in Kenya I've seen like our network providers being arrested, and it's not interesting. So at times they want to offer the service, but the fear of being arrested, fear of being taken to court and charged for illegally
Wait, so are you saying
terminating a
in Kenya,
pregnancy.
if you do, as a midwife, if you do provide termination services, you can be arrested?
Yes, it
Sure.
is, yes. I mean, it is in the Constitution. It states very clearly that abortion is illegal. However, it can be provided by a trained healthcare provider when the life of the mother is in danger. But for our lawmakers, they only read up to it is illegal, and it ends there.
Well, let me ask you this, Nelly.
Are we still on?
Yes,
Yes,
we
yeah.
certainly are.
Yeah.
Your president,
Yes.
Mr. Uhuru,
Uhuru
Kenyatta,
Kenyatta. Yeah.
was a guest here.
Yes.
Yesterday,
Yeah.
yes.
Okay,
Yeah.
And you
yesterday he
followed.
was there,
Yeah.
pomp and circumstance, being feted by the government of Canada, right? And it's great to see him to be in this context. But how did you feel when you know the problems that you suffer as a midwife and the problems that the country's policies are creating? Do you have access to the president of Kenya? And if you did, what is it that you would like to tell him? How did you feel seeing him? And secondly, what is the message that you would like to send to Uhuru Kenyatta?
Who? What would I want to tell Uhuru Kenyatta? Really, at this point in time.
That won't get you into too much trouble, I hope.
Yeah, no. The Constitution is clear. The Constitution is clear. I think what the lawmakers need to do is to study the Constitution. Because I can tell you that the cases that we've had in court, we've won. The ruling has been done to our favor. And the magistrate have stated clearly that the healthcare workers were only saving a life. And they are trained to do that.
Right.
So it is clear. So I think what we need to do is give information to lawmakers, have everyone in this field, the actors, trained for them to appreciate that abortion is legal under certain circumstances. I think that's what we need to do. Probably my president doesn't have anything to do with this. It's the people that come and arrest the healthcare providers. The magistrate that makes the ruling in our favor. I mean, those two people, those two departments need to talk to each other and tell them that, hey, these people are offering services as provided for in the Constitution, as a trained healthcare provider, as they are able to analyze and do and assess and find that your health, the health of a woman is in danger. Go further and define health according to WHO. Like it's
As a human right.
As
It's
a,
a human
as a
right.
human right.
Yeah.
Yes.
Yeah.
And the well-being of a woman.
Right.
So after they look at all that, I mean, that's the point they will decide if they want to arrest,
Right.
charge, or let you continue offering services. So I think our Constitution is clear and we are not supposed to argue about it.
Sure.
It's just that people never bother to go ahead and look at our Constitution and read to the end.
Right.
Yes.
And fight for the rights.
And fight
because
for
it's
the
such
rights.
it's not considered a sexy cause, so to
Exactly.
speak. Lucy, stigma. Religion does play a role in it. And I would love for everybody to have the right to worship in the whatever form that they
Whichever,
would. But it
right.
does feed into the stigma. How do you think we should tackle issues of religion when you have people like, it's not so much that the law says against this, but people are using their religion in order to infringe on women's rights?
It's a great question. I think in some ways also how we form our own morality and our own sense of judgments and our own attitudes is informed by religion. It's also informed by our role models, our families, our sense of selves. And I think I'm an optimist, right? So I also think there's an exception to every rule. And we've seen some incredible leadership from amongst religious leaders really speaking out against stigma, both in terms of stigma relating to HIV or stigma relating to same-sex relationships. And I think our religious leaders, just as much as our political leaders and our other leaders of different movements, have an opportunity and a responsibility to lead by example and to be inclusive, to be stigma-free, to welcome all to their whichever place of worship, from whatever religion it is, but to actually be inclusive in that space. And just in so doing, that in itself can send a message of acceptance, of tolerance, of confidence to all people, regardless of their own other identity issues, so that they can worship in a way that is meaningful for them and they can exercise their faith. So I'm optimistic about that, even though I know there's some other examples as well. But
Sure.
yeah.
Well, thank you very much for participating in this conversation. Thank you for your activism and thank you for your professionalism.
Thank
On that note, thank you very much for joining us. We'll see you next time.
Thank you so much.
Thanks.